Hi, I'm Dr. Larry Malerba, and welcome to this, the 31st episode of the All Things Homeopathy Materia Medica series. Today I'll be discussing Hyoscyamus niger. Hyoscyamus is a hydrophobic miasm remedy. It has many similarities to other hydrophobic remedies such as stramonium and belladonna. It's derived from the black henbane plant, which is a member of the Solanaceae family. When reading the old homeopathic books, it's easy to get the impression that this remedy is mostly reserved for truly extreme cases involving full-blown psychiatric pathology. And no doubt, if it were permitted to be used by trained homeopaths in psychiatric institutions, I'm certain that the results would astonish the allopaths. But it's also very valuable in everyday practice too. Hyoscyamus fits a wide range of emotional and behavioral problems in both children and adults. So it's not necessary to wait until a person is institutionalized in order to justify prescribing this very valuable remedy. All right, let's not waste time. Let's talk about Hyoscyamus niger.
Okay, so in most hyoscyamus cases, we tend to see some combination of loquaciousness, jealousy, hyperactivity, suspicious thinking, silliness, wildness, inappropriate sexuality, and/or aggression. The literature often places a great deal of emphasis on the jealousy aspect of hyoscyamus, and I don't disagree with that, but I would frame it a little differently. I think that the hyoscyamus jealousy is better understood as a form of attention-seeking behavior. In fact, most of hyoscyamus's symptoms fit nicely into the category of attention-seeking behaviors. But before we get too far down the rabbit hole, I'd first like to discuss etiology. What is it that causes hyoscyamus to act in such a manner? Well, in most cases, it results from some form of relationship breakdown. Hyoscyamus is a remedy for disappointed or unhappy love. It's a remedy for jealousy resulting from betrayal or having been deserted or let down by someone close or important to the person. Although this usually means the breakup of a romantic relationship, it can also involve a broken trust between friends, siblings, or parent and child. Naturally, losses of this nature result in hurt, woundedness, and grief. And we've seen how certain remedies like Natmur and Ignatia are used to heal dysfunctional responses to such situations. Hyoscyamus, too, is a remedy for unprocessed or dysfunctionally managed grief or hurt. The underlying emotions of hurt and loss are, in essence, displaced, and instead, we tend to see jealousy and other maladaptive behaviors. Instead of processing emotions in a healthy manner, the person becomes excessively talkative and begins to display jealousy toward the lover, sibling, or romantic rival. Instead of grieving, the person tends to talk incessantly, and even though the talk tends to revolve around the situation, all that talking amounts to just mental chatter that never really addresses the grief on an emotional level. Hyoscyamus lists prominently under mental and emotional ailments caused by disappointment or unhappy love. Now, not all cases can be traced to some instance of disappointed love. Sometimes a child simply inherits the hyoscyamus energy from a parent. In addition, it also lists under mental and emotional ailments caused by fright. Now, as I alluded to earlier, many of hyoscyamus's behaviors can be understood as attention-seeking behaviors. The ailment produced by betrayal or unhappy love is one that causes the person to seek to regain the love and attention that has been lost. And it's not so much an intentional strategy to gain back attention as much as it is an unconscious psychological complex that drives the person's behavior. In other words, The person doesn't recognize why he feels compelled to talk so much, and the child doesn't understand why he acts out in disruptive ways. Furthermore, as far as the Hyoscyamus type is concerned, it doesn't seem to matter whether the attention gained is positive attention or negative attention, as long as it's just some form of attention. In many cases, the individual appears to thrive on negative attention. We can break these attention-seeking behaviors down into various categories, but their overall net impact is basically the same. They tend to make people sit up and take notice. There's a manic, hyped-up quality to the Hyoscyamus state of mind. It can be mild, with restlessness and talkativeness, or it can intensify into wilder and more erratic behaviors with laughing, swearing, and relentless chatter. Although there can be rage or aggression, like with stramonium, Hyoscyamus usually exhibits more manic craziness than actual violence. In extreme cases, there can be sexual mania and even psychosis. Now, the one keynote Hyoscyamus clue that stands out above all others is loquacity. And what better way to get attention than by talking and talking and talking? Imagine an abnormally animated or extroverted person who speaks rapidly and excitedly. The Hyoscyamus loquaciousness is rather disorganized and rambling, frequently changing from subject to subject. It can be loud and obnoxious, but it can also be low-key and relentless. Sometimes there can be involuntary stammering. Hyoscyamus types don't often give me the feeling that I get with lachesis, which is that if I dare to interrupt them, they may become hostile. Hyoscyamus is less likely to take offense when interrupted. This remedy is relatively easy to spot in children. This is the kind of kid who engages me in my office without the normal inhibition that one would expect. I remember one little boy who, on our first encounter, kept running over to where I was seated and pulling on my shirt sleeve to get my attention. He did this repeatedly, in a loud voice, exclaiming, "Dr. Malerba, Dr. Malerba," making sure that he had redirected my attention away from his parents before making his point to me. When tactics of this nature fail to disrupt the flow of conversation between the adults in the room, such children may feel compelled to take more drastic measures. So another way to gain attention is to do things for shock value. Hyoscyamus often behaves in ways designed to shock or provoke others. One such way is to use humor. Sometimes Hyoscyamus's humor comes across as just humor, but in many cases it's as if the person isn't aware of normal social boundaries. He simply doesn't know how to stop himself. Hyoscyamus tends to make jokes frequently and repeatedly, even after the conversation has turned serious. Oftentimes it's more off-color or outrageous humor. I suspect that a good number of professional comedians could benefit from Hyoscyamus, especially the ones who use foul language or sexual innuendo to get their biggest laughs. Hyoscyamus fits adults who like to play pranks or kids who have reputations for being the class clown. These are the kids who make farting sounds, weird faces, or obscene gestures, or blurt things out in class to get a laugh. Sometimes all that joking and humor spills over into more disruptive, foolish types of behaviors. The person may become loud and silly with a tendency to laugh wildly and uncontrollably. Hyoscyamus lists prominently in repertories under laughing from disappointed love, laughing about trifles, constant laughing, laughing at everything, silly, foolish laughing, hysterical laughing, laughing immoderately, laughing loudly, and uncontrollable laughing. Although these Hyoscyamus habits can be quite annoying, there's no doubt that in his own mind, he's absolutely hilarious. Now, another guaranteed way to grab attention is through provocative or inappropriate sexual behaviors. Hyoscyamus is a highly sexual remedy, and promiscuous behavior is just another tactic that can be employed to attract attention. Hyoscyamus can be shamelessly and uninhibitedly exhibitionistic. This naturally entails a relative absence of the normal social modesty that one would typically expect to see. Hyoscyamus can be sexually provocative and may use vulgar language, sing obscene songs, or remove articles of clothing, all just for shock value. These are the adults who crack sexual jokes or make frequent use of sexual innuendo. These are the kids who use potty talk and sexual language to shock their friends. Hyoscyamus kids can masturbate at a young age, and they may streak naked through the sitting room when their parents have guests over for coffee. Hyoscyamus lists prominently under male libido increased, female libido increased, lascivious uncovers sexual parts, shameless exposes the person, lewdness with obscene talk, want to be naked, desires to sing obscene songs, and erotic insanity with jealousy. Now, it's important to understand that these shameless and exhibitionistic sexual behaviors can span the whole spectrum, from mild and subtle to overt and in your face. Although these behaviors can be intentionally provocative, it's also true that they are dysfunctional human responses to psychological suffering, and therefore not entirely voluntary. Additional provocative attention-getting rubrics worth considering include loquaciousness, plays antics, foolish behavior, makes ridiculous or foolish gestures, foolish behavior like monkeys, mirth, hilarity, shrieking, screaming, and shouting, and wildness. Now, if excessive talkativeness, wild silliness, or sexual provocation fail to get the desired result, one possible last resort is aggression. As stated earlier, although Hyoscyamus tends to be less violent than, say, stramonium, for example, it's still capable of aggressive behavior. Hyoscyamus can be angry and quarrelsome and may resort to mockery. At its worst, Hyoscyamus can become violent and destructive and may desire to kill. It's the strongest remedy listed under desires to kill out of jealousy. Now, Hyoscyamus can also be useful at the far ends of the age spectrum. It fits older people who exhibit signs of disinhibition due to dementia. These people may become excessively loquacious and can act out foolishly with sexually inappropriate and shameless behavior. Hyoscyamus is also very commonly indicated for young children with attention deficit and hyperactivity problems. These children typically have very poor impulse control and tend to exhibit all of the previously mentioned attention-getting behaviors. There can be extreme talkativeness, foul language, potty humor, sexual talk, and excessive silliness. All such behaviors are designed to draw attention, regardless of whether it turns out to be positive or negative attention. There can be precocious sexual behavior with early masturbation, exhibitionism, sexual talk, and frequent touching or handling of the genitals. I've witnessed non-nursing children reach out to grab their mother's breasts, and they do this with a mischievous grin on their faces, knowing that it will get a rise out of those who are watching. If I suspect hyoscyamus, I ask the parent about how the child acts when the parent is talking on the phone. Many hyoscyamus kids are unable to tolerate this and will do everything in their power to disrupt the phone call in order to redirect the parent's attention back to themselves. They may call out to the parent repeatedly, shout and scream, or instigate some kind of trouble that the parent simply can't ignore. It's not uncommon that these kids will act out, especially when a new child is brought into the family. The hyoscyamus child often views the newborn as an unwelcome competitor for attention. Parents of such children are wise to keep an eye out for malicious behavior that might be directed toward the infant. Likewise, these kids will intentionally goad older siblings into doing something forbidden and then gleefully watch them take the blame once the cat is out of the bag, so to speak. This kind of jealousy or sibling rivalry is very common with hyoscyamus children. Now, another aspect of the hyoscyamus mindset is suspicion. Hyoscyamus tends to be mistrustful, suspicious, and in the worst case scenario, outright paranoid. Naturally, when one is jealous, it follows that that person may not trust the motives or intentions of others around him. A number of hyoscyamus fears and delusions tend to reflect this suspicious mindset. Hyoscyamus lists prominently under fear of being betrayed, fear of being poisoned, fear of being alone, fear of dogs, fear of animals, fear of being bitten, fear of water, delusion that he will be bitten, imagines something coming out of the corner, delusion he is pursued by devils, delusion of being injured, delusion that he is persecuted, delusion he is pursued by enemies, and delusion that he has suffered a wrong. You may notice that hyoscyamus's fears are somewhat similar to stramonium's fears. It's sometimes difficult to differentiate between a child's fear of being alone versus a fear of the dark. My observation is that with stramonium, the emphasis is on fear of the dark, while with hyoscyamus, the fear is more about being alone. Okay, so I'm only going to talk briefly about the generals and modalities because, to be honest, hyoscyamus's pathology is so heavily skewed toward the mental emotional that there aren't many generals or modalities that are particularly useful to us. In other words, we most often prescribe this remedy on the basis of its psychological characteristics. I refer you to Clinical Case Series number 7 as a good example. In that episode, I was guided to the remedy for a case of post-COVID loss of smell, primarily by using the mental emotional characteristics. Okay, so with that said, hyoscyamus is generally on the chilly side and tends to be sensitive to cold. There's also a tendency to complain of dryness. There can be dryness of the mouth, lips, or throat. Sometimes touch can aggravate symptoms. Sleep troubles, nightmares, and insomnia are common problems, and this makes sense given the busy nature of the hyoscyamus mind. There's a general desire for company, and company tends to ameliorate. And lastly, many hyoscyamus conditions are aggravated by certain emotions, especially jealousy, fright, and unhappy love. Now, a great deal of Hyoscyamus's physical symptomatology tends to fall under one broad category. Hyoscyamus is primarily a nervous system remedy. It fits a wide variety of neurologic symptoms and conditions. The crude substance is capable of producing pathology on mental, emotional, and physical levels. Most of its physical symptoms are spasmodic in nature. It fits just about every kind of cramp, spasm, jerk, twitch, and tic imaginable. Twitching and spasms can occur anywhere in the body, but especially in the hands, feet, and face. Hyoscyamus fits ailments from brain insults, whether they occur after a high fever, a concussion, meningitis, a stroke, or from alcoholism. Resulting symptoms can include restlessness, convulsions, and involuntary motions of the extremities. During delirium with high fever, Hyoscyamus is prone to making strange involuntary gestures with the hands. The books refer to this as carphologia, which is a condition that involves aimless movements, as if picking at the bedclothes for strands of lint, or reaching for imaginary things, or grasping at the face or genitals. Hyoscyamus is also a remedy for seizure disorders. It fits convulsions from fright, grief, or rage, and from fever, alcohol, or stroke. The seizures can be aggravated around the menses or are worse during sleep. It fits petit mal seizures and complex partial seizures. Tinnitus or vertigo may precede a hyoscyamus seizure. Hyoscyamus also fits chest spasms, grinding of the teeth, stiff neck, and strabismus, which is a condition that involves spasms of the eye muscles. It fits dry, spasmodic, tickling coughs that are worse when lying at night and better from sitting up. Additional spasmodic symptoms include choking and difficulty swallowing, especially when swallowing liquids. It fits stomach cramps and diarrhea with colic, and it's almost specific for problematic hiccups that occur after abdominal surgeries. Furthermore, hyoscyamus can be a remedy for bladder paralysis with urinary retention on the one hand, and enuresis, involuntary urination, or involuntary stool on the other. Okay, now let's finish up with remedy relationships. All right, now, the most important remedy to compare to hyoscyamus is lachesis, which is similarly loquacious. Years ago, I used to prescribe lachesis for some extremely talkative people when I probably should have given hyoscyamus. Both are suspicious, paranoid, and jealous, but lachesis is far more likely to exhibit hostility when questioned, whereas hyoscyamus tends to be less angry or aggressive toward the probing interviewer. Lachesis has a sharp, pointed, sarcastic wit, while hyoscyamus is silly, ludicrous, absurd, and hilarious. Stramonium has a similar fear of dogs, fear of water, and fits hyperactive kids, but there's one big difference. Stramonium is fundamentally fear-based and is therefore much more reticent and cautious during an interview. Stramonium kids may be quite reluctant to speak. Hyoscyamus is much more talkative, open, and expressive, oftentimes pathologically so. And as noted earlier, stramonium is afraid of being alone, especially in the dark, while hyoscyamus is primarily afraid of being alone. Cannabis indica is also loquacious, is prone to laughing, can be hyperactive, and is afraid of the dark. While cannabis tends to giggle in that way that we associate with a marijuana high, Hyoscyamus often laughs in a loud, maniacal kind of way. Furthermore, the cannabis loquacity is more akin to fantastical theorizing about the nature of existence and other philosophical speculations. Belladonna has a similar fear of dogs, fear of water, can be loud and talkative, and fits a wide range of spasms, twitches, and convulsions, especially in relation to fevers and brain injuries. Veratrum album is also hyperactive and can be suspicious, deceitful, jealous, and vindictive. And lastly, Tarantula is similarly restless, deceitful, destructive, and fits hyperactive kids. All right, that's my take on Hyoscyamus. I hope you found it to be helpful. It is a fascinating remedy. Please don't forget to share and subscribe, and that way you'll be notified of future All Things Homeopathy episodes. May the vital force be with you always.